Vaccinations have been a hot topic of debate recently across the nation, and with an outbreak of mumps in Idaho, that debate hits close to home. Ben Lyda for Idaho's First News has more on preventative measures and local reactions.
We kind of have a unique situation right now. We have a mumps outbreak in Idaho, we have a measles outbreak in the United States, and so we are recommending that everybody checks their vaccination status against both of those diseases, and they can get one vaccine that covers both.
Idaho public health officials warn of an outbreak that began last September among students at the Moscow campus of the University of Idaho continues to spread. Idaho has 21 reported cases, including 6 in the Boise area.
College campuses are hit a little harder with disease because people are they live in close quarters. They're around people. They're taking classes together. Colleges don't always require immunization, so there are people who are unimmunized.
Officials say the measles, mumps, and rubella vaccine is the best way to prevent the disease. However, there are still people who choose not to have children immunized.
People don't vaccinate for a number of reasons, and maybe it's religion, maybe it's medical reasons, maybe it's they just don't believe in them. We try to educate people to the right reasons not to vaccinate, but people, they do what they want, and they have a right to do that.
I have 4 boys. They are all vaccinated. I felt pretty safe about the vaccinations myself. They are good and healthy. So
my younger children, I didn't have them fully vaccinated. I'm not even sure if they were vaccinated at all. I really believe that there's some problems with our vaccines these days, and I have advised my children, I have 7 children, and I've advised them to study it out before they have their children vaccinated.
We warn people that if they're not vaccinated to stay away from outbreak settings, but the best thing to do is get vaccinated and make sure your family members and friends are vaccinated as well.
Whether you're for or against vaccinations, the facts are there and the choice is yours. In Twin Falls, Ben Lyda, Idaho's First News.
Anyone infected with the mumps virus should stay home for 5 days after symptoms begin and minimize close contact with other people.